Hi everyone, so today I'm going to be talking about pain management in patients with a history of opioid abuse. There's a growing opioid epidemic in the United States as there are over 60,000 deaths attributed to overdose in the state each year. Coupled with that, there are an increasing number of Americans that are suffering from acute and chronic pain. But nursing assessment and rapport with patients can significantly impact how patients respond to these conversations about pain and addiction. So in order to effectively treat patient pain while prevented opioid abuse, there are several current trends that are occurring in order to control this epidemic. These include no prescriptions for opioids at all going out, heavy nursing assessments for risk factors and history, and individualizing patient care. So the first one is no prescription for opioids at all, and this is an extreme attempt to control the prescriptions that are outgoing, and it prevents patients from clinically being addicted to opioids, at least while they're in the hospital. Rothstein in 2017 said that these non-opioid policies are a result of a belief that treatment of chronic pain that is non-cancer related has unproven benefits and serious risks. Also, there are nurses and physicians that are out there that do not want to deal with patients with addiction simply because they lack the addiction training and the proper way to taper opioids from high to lower doses. While this controls some of the epidemic that's occurring, this does not prevent patients from seeking illicit drugs or non-prescription opioids once they leave the facility. The second area would be heavily relying on nursing assessments. They can play a role in assessing these patients for addictive behaviors, for risks, and for their history. RNs have a unique relationship with patients because they are at the bedside so frequently, and they have a better rapport with patients than a lot of other people within the healthcare system. We provide a lot of direct care, care coordination, and executive roles, and we can help the patients understand the risks and the benefits more than a lot of other people. And this is seen as more manageable because it actually listens to the patient's complaints and it actually takes a real look at their history and why they're in the hospital. Thirdly, the third trend would be to individualize patient care because not every patient is going to be the same. So not every patient would need a narcotic or an opioid, and a lot can be managed with non-opioid therapies and modalities and non-pharmacological modalities as well. These non-opioid drugs can include NSAIDs and Toradol and certain antidepressants such as Cymbalta and Elavil. So my recommendations would definitely be to individualize patient care while heavily assessing them and advocating for your patient because that is the role of the RN. And this, for me, would include tapering certain drugs before discharge, definitely speaking with them about non-opioid alternatives to opioids, and